Hello everyone, welcome back to another episode of Dr. Deepa's Learning Launch. Today we are exploring one of the most fascinating themes in pathology, differentiation and altered differentiation. By the time you finish listening, you will have a crystal clear picture of how our cells mature, how they regenerate, how they adapt during stress, and how these adaptations can sometimes take a turn towards disease. Let's begin with the idea of differentiation. Every cell in our body starts off with the same basic blueprint, but gradually takes on a unique identity. This process, where a simple immature cell develops into a special structure and function, is called differentiation. It's the reason why the neuron looks different from the liver cell, and it's the reason why the cardiac muscle functions differently from the skin cell. Differentiation is basically the nature's way of giving every cell its personalized role in the grand functionality of our body. Now, throughout life, the cells constantly are being lost, either due to the natural turnover or due to injury. To make up for these losses, the body uses a remarkable process called regeneration. Regeneration depends heavily on what type of cells are we talking about, because not all cells have the same capacity to multiply. Some cells, like those in the skin, the oral cavity, the gastrointestinal tract, and the blood forming cells of the bone marrow, keep dividing throughout life. These are called labile cells. They're constantly renewing themselves, which is why superficial injuries to the skin heal very quickly. Even in cosmetic procedures like chemical peels or microdermabrasion, the same principle is used for rapid turnover of the damaged tissue, which makes the skin look fresher. Then we have stable cells such as hepatocytes in the liver, renal tubular cells, smooth muscle cells, and fibroblasts. These cells remain quiet, but when the injury occurs, they suddenly become active and start dividing. The liver is one best example for this. Even if a significant proportion of the liver is removed during surgical resection, the remaining hepatocytes can multiply and restore the organ to a near normal size. And finally, we have the permanent cells, which are the neurons, cardiac muscle fibers, retinal cells, etc. These cells divide only during the fetal life and not during birth. So when they are damaged, the body cannot replace them with new functioning cells. Instead, a scar tissue develops in their place. Although the modern research hints that some minimal regeneration potential is present in these cells, it is not near enough for a full restoration of the function. At the center of the regeneration lies the most fascinating population of cells, the stem cells. The stem cells are the parent cells that give rise to specialized cells of the body. In the earlier stages of development, we begin with a totipotent cell, which is a single fertilized egg. This cell gives rise to pluripotent stem cells, and these pluripotent stem cells then differentiate into three germ cell layers, which is the ectoderm, endoderm, and mesoderm. From these three layers, every organ and tissue of our body is formed finally. Pluripotent stem cells have captured tremendous attention in modern medicine because when cultured in controlled conditions, they can be guided to form different cell types. This is why stem cell therapy is now being explored for repairing damaged heart muscle, spinal cord, liver failure, or even neurodegenerative conditions. There is also a fascinating concept called transdifferentiation, where one type of stem cell is reprogrammed to become a completely different type of cell. For example, the blood forming stem cell, which normally produces blood cells, is being guided to form a neuron or a cardiac muscle cell. This opens the door for future regenerative therapies that once seemed impossible. Now that we understand the normal differentiation, let's move on to altered differentiation. When a cell is exposed to continuous stress, irritation, or toxic influences, they may adapt by changing the pattern of differentiation. The two major forms of altered differentiation are metaplasia and dysplasia. Metaplasia is a reversible change where one mature cell type is replaced by another mature cell type that is better equipped to handle the stress. A classic example is what happens to the lung of chronic smokers. Normally, the bronchial lining is made up of ciliate columnar epithelium, which helps clear the mucus. But constant exposure to cigarette smoke irritates the lining. To protect itself, the tissue transforms into a tougher, stratified squamous epithelium. This does provide resistance, but the new cells lose their cilia and therefore lose the clearing function. So it becomes sort of a trade-off. Another example is the Barrett's esophagus, in which people with long-standing acid reflux, the lower esophagus that is normally lined by squamous epithelium, becomes lined by columnar intestinal type of an epithelium. This epithelium can tolerate acid better, but it also increases the risk of cancer later on. Metaplasia can also happen in connective tissues. In a condition called myositis ossificans, trauma to the muscle stimulates the fibroblasts to form bone-forming cells. This leads to some islands of bone that appear in the middle of the muscle. So ultimately, it becomes a very painful sort of a condition. Now let's talk about dysplasia, a term that every pathology student must understand thoroughly. Dysplasia is a disordered abnormal growth of cells. It is characterized by increased proliferation, irregular and atypical cells, and loss of normal architecture. Under the microscope, the dysplastic cells may show variation in size and shape. They may be an increased nuclear cytoplasmic ratio, darker than usual nuclei, or disturbed orientation. They may show increased mitotic activity, including abnormal mitotic figures. Dysplasia tends to occur in tissues subjected to chronic injury, chronic inflammation, or carcinogenic exposures. Mild dysplasia may be reversible if the underlying stressor is removed, but as the dysplasia progresses, the changes become more severe and permanent. And when the entire thickness of the epithelium is replaced by atypical cells, but the basement membrane still remains intact, we call it carcinoma in situ, a stage that is severe but still non-invasive. Once the basement membrane is breached, the lesion becomes an invasive carcinoma. This progression from metaplasia to dysplasia to carcinoma is beautifully illustrated in the respiratory tract of a long-term smoker. The pseudostratified ciliated epithelium first becomes squamous because of metaplasia. When the smoking continues, dysplasia develops. If the irritant exposure persists, it evolves into a carcinoma in situ and eventually into squamous cell carcinoma. The good news is the early stages are reversible if the stimulus is removed, which is why the smoking cessation becomes very important. Before we conclude, let's briefly touch upon the differentiation of tumors. Benign ones are well differentiated, meaning they closely resemble the tissue of origin. Malignant tumors vary widely. Some may be well differentiated, while others may be moderately differentiated, and some may be poorly differentiated, meaning they show no resemblance to the parent tissue. These poorly differentiated anaplastic tumors are more aggressive. They have bizarre looking cells and have a very rapid growth pattern. So to wrap up today's session, differentiation gives rise to specialized cells. Regenerative medicine depends on regenerative capability of different cell types. Stem cells are the foundation of renewal and repair. Metaplasia is reversible adaptive change. Dysplasia is a disordered, potentially pre-malignant change. And together, these processes helps us in understanding how normal tissue function and how disease begins. Thank you for joining me today and hope this session deepened your understanding and sparks your curiosity even more. Stay tuned for our upcoming episodes and as always, keep learning, keep growing and keep exploring the beautiful science of pathology with me, Dr. Deepa. Don't forget to like, subscribe and share my content with all your peers because sharing is caring. Bye guys, let's catch up on the next podcast.